Good evening. I'm Dr. Sayyed Amjad, Interventional Cardiologist from Solapur, the owner of a Noble Hospital, Solapur. The sympatho-inhibition should be the goal of hypertensive treatment patient. A reduction in sympathetic cardiovascular drive may trigger a series of favorable cardiovascular and cardiometabolic consequences. As we just now saw, what is the side effect or maybe effect or deleterious effect of sympathetic overdrive? If you cut down the sympathetic overdrive, probably we can conserve a lot of things. So there will be improvement of metabolic parameters, the regression of target organ damage, reduction in 24 hours blood pressure variability, which is a marker of the atherosclerosis and sudden cardiac death, and homogeneous blood pressure control during 24 hours period. That should be the goal in any hypertensive patients. So along with any other antihypertensive, if you add on a drug which will control the sympathetic overdrive, probably the control will be towards the goal and the long-term benefits will be seen. That is the reason we are discussing this today. If you see the drugs and their effects on sympathetic nervous system, there are so many drugs available. The central sympatholytic drugs, there is a marked reduction. And if you see the effects on peripheral sympathetic nervous system and central nervous system, the cardiac sympathetic nervous system, there are different effects of different drugs. But the most commonly used and the most beneficial drug is a beta blocker, which will reduce the effect of peripheral sympathetic nervous system as well as effect on cardiac sympathetic nervous system. So this is the drug probably will be more beneficial. And other drugs like alpha blockers, like there will be peripheral sympathetic nervous system will be reduced, but then cardiac sympathetic nervous system, they don't have direct effect. Or diuretics, there is marked increase in peripheral sympathetic nervous system because of hypertension and fluid loss. Short-acting calcium channel blocker or long-acting calcium channel blocker, either they don't have any effect of cardiac sympathetic nervous system or they have only effect on peripheral sympathetic nervous system. So the only drug probably which can affect both the peripheral sympathetic nervous system as well as cardiac sympathetic nervous system is a beta blocker. So that should be a drug of choice in such patients. So sympathetic overdrive and hypertension management in Indian scenario, if you see, metoprolol is the most commonly prescribed drug. Followed by metoprolol, there are a lot of combinations of metoprolol with amlodipine and olmesartan. And there is a large study which says the systolic reduction of the blood pressure with metoprolol is almost like 25 millimeter, and the combination is still more. The average reduction of heart rate is around 15 beats per minute, and there is no serious side effects of metoprolol being added to the armamentarium of antihypertensive drugs, especially if we see the background of sympathetic overdrive. Such patients should definitely be added with beta blockers. And the initial concerns with beta blocker adding to hypertensive patients because of a large meta-analysis are now nullified by these studies. So, but of course, the drug of choice now is metoprolol rather than atenolol. So I think today's scenario, adding a metoprolol to a hypertensive patient is very important in terms of managing the complications of hypertension. Thank you very much for patiently listening.